Hello, my name is Christian Ocampo. I'll be doing my video validation, doing a wet to dry dressing on my mannequin patient over here for section 602 of nursing foundations. To begin, I'm going to read off the 7 rights that you should do before even interacting with the patient. They are to identify the patient, introduce yourself, check physician's orders, provide for privacy, do your own hand hygiene, gather your equipment, and explain the procedure to your patient. Alright, so let's say we already did all of that, and instead of doing a clean dressing, it's going to be a sterile wet to dry dressing. So to start off, we're going to go to our patient and tell our patient that we're going to be doing a wet to dry dressing on her. It might be a little bit painful, so you want to ask if the patient is in any pain. Regardless if they are, you want to offer them some medications beforehand, because this can potentially be quite painful for them. So you definitely want to offer that to your patient. More often than not, it'll be, yes, please give me the pain medication. So to start off, I'm just gonna put down this handrail. It'll be easy for me to work with, so I'm not, leaning over my patient. So I'm just gonna don him some gloves. Quick. These are just some clean gloves for now. We will be using some sterile gloves later on. Okay. You want to make sure you have a trash bag or like a little trash can readily available within your arm's reach. I have mine right over here. So we're just gonna quickly just look at the wound and expose just the site, maintaining as much privacy as possible. And then we're just gonna take a look at the wound, just like so. We're gonna note, how it looks, when was the last time it was changed, any color change, and all that stuff. So next, we're just gonna remove it, just like so. The first layer is gonna be an ABD pad. So, this can go in the trash. Once again, we're constantly assessing, if there's odor, color changes, how much drainage we're getting, if it's like sanguinous, serosanguinous, and all that stuff. Looking at that. Also, once you get to the part where you're removing the packed gauze from the wound, you want to make sure that you're noting what this specific gauze looks like. If it's like draining a lot of, if it's like soaking up a lot of blood, or it's mainly pus, or is it just serum. Take note of that, because you are going to have to document it, just like so. Once again, we're just taking a look at our wound here. Looks good for now. Nothing too out of the ordinary. So our next step is to remove our gloves. Then we're just going to wash our hands. If that's not really available for you, use some hand sanitizer and get that over and done with, because we're going to be now setting up our sterile field. So I have a table right here, and you may want two, just in case. Just going to do this. So we have a 1-inch border for our sterile field that we are allowed to touch, just like so. And of course, this is after you washed your hands, after removing the clean gloves. Next step, we have a bowl. Just going to quickly undo this. That. making sure it's not touching inside of the field. I'm just gonna drop that in. So I'm gonna put some sterile water or some normal saline into the bowl here. I'm gonna make sure that it's not spilling. Seems good enough. Next is gonna be some gauze. You're gonna need quite a bit of gauze for this procedure. You would rather have too much than too little. Close. Once again, because this is sterile inside, you don't want to touch it with your bare hands. Now, of course, you don't want to tear right through the packaging, because that's how you ruin the sterility of the gauze. So, next up is going to be our ABD pad. So, okay, so now we have a sterile field set up. Because it's sterile, now we're going to have to don on some sterile gloves. So since I don't have room here, I'm forced to actually make room on that. Just going to prep this. I'm also going to set up some tape, because once I apply on the tape, I'm going to use the tape to apply on the ABD dressing in the future. So while I'm here, yep. Just like that. I'll have one more just in case.
Yeah.
Just like that. So, back to our gloves. So I'm just going to set this down real quick. Once again, you also want to make sure that your patient does not have allergies to latex, because some sterile gloves do contain latex, so just keep that in mind. Alright, now I'm just going to don on some gloves. Start with my right. My phone just. Alright, my phone stopped recording, so just a disclaimer. If this is part 2 now. So I just put on my sterile right hand glove. Now we're gonna go to our left.
Yesterday, and the nurse there was an on-call nurse for hypertrack, and she does all kinds of.
Think so? And adjust. Okay. Now we're ready to handle the wound with sterile technique. So hands above the waist, no back against the sterile field whatsoever. So our first step, we're gonna take sterile gauze, dip it into our little sterile basin, and we're gonna wring out the water. Make sure it's not dripping, because if it drips all over the sterile field, it ruins sterility. So, first step, we're actually going to clean this real quick. So, first step, just a quick swoop, and then discard. Second one. Now, same thing. Now for the other side. Just like that. Close.
Time goes fast.
Yeah, I had to do, I held up bag of normal saline and then I.
Now for the other side.
Yeah, I'll look at everything.
Now we're gonna get ready to pack. Like so.
Right, that's ready, yeah.
I'm done with you. I'm in cardiac arrest right now. It's not bad. It's like, it's not bad at all. I'm just frightened with maternity next year.
Now we're gonna
Like something that I could help with
pack.
I mean, but I explained it to my microbiology
Just like so.
professor. So he's like, how are you doing? I'm like, no, I'm good. Dr. J? Dr. J. So I go.
So when we're packing, you want to make sure that
I'm gonna go cardiac respiratory.
it becomes level with the rest of the body. So it's level with the upper border of the wound.
That's a little different. That's a little different with the baby.
I can't take it. I couldn't take it, baby. That's why I don't do it.
And let me tell you something, everything else taught me in pain, and I run into something that he taught me
Keep
in
packing.
every level of nursing. Every level, and he
So
prepared
while
me.
you guys are here, is there anything that I could tell you guys? Or you want to know about?
How do you get through maternity?
Maternity, is that supposed to be the hardest one?
That's gonna be high level.
I think it is. Maternity is different. It's a different type of nursing.
It's a different type of
but,
test too, like the testing has more questions, and you can go back, right?
No,
Don't
it's,
build
it's,
that.
no, it's just different, but everybody has
Are
their
you a
own
nursing
thing.
student here?
Yeah, because you use my own.
That's why I wear all
Oh, I see. Because you're depressed now, is that what you're trying to say?
Terminology and different things that you would do in med surg that you wouldn't do in med surg unless
Sounds like so.
it's medical field. Then you would do that. But otherwise, it's dealing with
Now, once we're happy with that, we're gonna take some
I'm just gonna
gauze,
get through it, 'cause
clean
it's
gauze,
not what
clean
I
dry
wanna
gauze.
be. Like all my cohorts, like, oh.
No, I think you're gonna enjoy it.
Yeah, I know.
No.
I mean, come on, you're a mother.
I like my kids. A lot.
Oh my God.
And I'm not saying I don't like other people's children, but it's very hard.
Our final
to
step
deal with. You have to deal with the baby, then you have to deal with the mother, and then you're not
that
just
we're
gonna
now
have
just
like
gonna
all
apply
healthy
the
babies
ABD pad
coming out,
earlier,
there's stillborns, there's sick babies. there's-
Those are rare.
and then just
I know 9 out of 10
so.
are healthy, but there's still, and I don't wanna see that drug addicted baby. I always think of the other side.
And we're just gonna-
It's not like
Give
you're
you a
gonna be-
perspective story a little bit that will just change your whole way of looking
quickly
at it.
apply on the
Just
tape.
like, you know, we all watch Grey's Anatomy, nothing.
Since we
but
broke
Grey's
sterility,
Anatomy.
our gloves are now
Yeah.
considered non-sterile.
Exactly, don't even think
So-
about those TV shows.
No, no.
Feel free.
They have nothing,
Nothing to do with
because I
it.
don't even watch them.
I
Quickly
actually
move.
watched the, like, more of the documentaries.
So,
like,
the
when they
amount of
film,
tape
like,
that you're applying and how you're
that's
taping it,
actually happening and stuff like that. And
it's going to be
so
dependent
funny.
on your patient
They do our
and how well
ERs.
they,
film
uh,
our ERs. It's like
can
gunshots,
tolerate activity.
boom, car accident, drunk driver, juggling, then they do another show where they're doing the ER.
So I'm just going to
and
remove the sterile
it's
gloves.
Like stub toe, stitches. They don't have any like like they have like bee sting anaphylaxis. That's like their major thing. Like this it's like then we
Wash hands
a
again.
British,
So I remove
a
my
British
gloves.
student came over and he was
And I'm just
like,
gonna
"Oh,"
quickly
they're like, well, what do you want to see
date
most?" He's like, "I
and
really
time
would like to see
my dressing.
if it happens, somebody like with a gunshot.
And then
They're
we're
like,
going
"Oh,
to
bed 1, 2,
get your patient comfortable
Like,
again.
what? Like, you could-
We're going
they
to
don't-
document
they
how
don't
the
have guns over there. Like, if they do-
how the
if you get
procedure
caught
went,
with a gun
how
on
well
you,
the
you're in
patient
jail.
tolerated it, and we're going to come back every so often
I'm
to
not saying people don't
reassess
have
the
guns,
wound
but
and
when
see
they
if it
get
needs
caught,
to be
you go to
changed
jail.
once again. And I'm just going to dispose the rest of this once again,
He said that when he was in United Kingdom.
making sure
Are any of you registered officially for next semester?
Yeah, I am.
I am too.
I'm taking mental health first.
Me too. So we'll be together.
I know, I'm taking mental health first.
Just making
because I
sure that,
know I'm not gonna study
patient's
over the summer.
comfortable,
'Cause Sam
didn't
told
get
me, he said,
anything,
"Take maternity
nothing
leave,
now.
you can study over the summer." Like,
Clean
yeah,
everything
I
up.
don't know how this is gonna come off.
set up lowest position, rails all up.
Follow the path.
And document your
There's
findings.
No secret
There's
formula
no
to
secret
take
formula,
this
right?
person.
I love
I
that.
think
I wanna
Professor
be
Ruiz
in
is an awesome
Okay,
person.
so
mental
just
health
another
or, like, drug
tidbit.
addiction or something like that.
If you have leftover saline in the bottle that you didn't use, and
Yeah, yeah.
Did
You know,
see there's an
in the bowl
employment
here,
opportunity over the summer?
just
I guess,
date and time it,
what's it called?
because it's still good for
Working
24
regional
hours
procurement, Newbridge,
once it's
right?
been open.
Okay.
They
All right?
want, people
So,
to work as behavioral health counselors.
that's just a little
Oh, yeah?
tidbit.
I'm pretty sure
So,
that's like stuff
you know,
with, like,
For,
drug
like,
rehab and
mental-
get a
whatnot.
patient all
Like, yeah,
comfortable,
look into
bed
that.
at the
Yeah,
lowest
I want a
position,
job over the summer.
Definitely. But I know my
give the call bell
myself,
light,
when I have the kids over
you
the
know,
summer,
breaks on the bed,
I always say,
you know. This one's all patient safety.
And I never get to
Yeah, I
it.
gotta
Because
show
I'm
you.
doing laundry and
Come on,
cleaning and taking them to work. And then when I get back to school, it takes me a
So
while.
let's just say
to,
this is
like,
the call
get back
bell.
into
We offer that to our patient.
school mode, so
We
that's what
offer,
I'm doing.
if our patient needs
Then
anything
school
else,
first, then I'm
so
in
like maybe
school mode, then I'll do
ice
maternity,
chips,
because here's some more tests.
if they're allowed, maybe some water, if they're allowed.
Alright. I got you, so after you graduate, you still
Make sure
have
they're all
years.
comfortable, and we're just gonna clean up after ourselves. And that's how you do a sterile wet to dry dressing, guys. Thank you.
Taking classes.